Hi everyone, welcome to the Let Me Tell You channel. In today's video, I'm going to talk about a very important and delicate subject, the secrets of mental institutions. This is a topic that is often overlooked, but deserves our full attention and reflection. To begin with, it is important to understand that these institutions are places designed to treat and care for people suffering from mental or psychological disorders. They are managed by trained professionals, such as psychologists, psychiatrists, and nurses specialized in mental health. However, they are often the target of criticism and discussion, especially when it comes to the secrets involved in the routine and treatment of patients. It is important to emphasize that there are many cases of violence and negligence within these institutions, which makes the need to discuss and expose these secrets even more urgent. For much of the 20th century, treatments used in mental institutions focused on containment and punishment rather than cure. Patients were often subjected to cruel treatments such as lobotomies and electric shock therapy, which were considered effective at the time but are now widely seen as inhumane and ineffective. The practice of electroshock is also known as electroconvulsive therapy. This technique is used to treat severe cases of depression, bipolar disorders, and schizophrenia. Through electrodes placed on the patient's head, an electric shock is administered that causes seizures and acoustic changes. Although it is a controversial technique, it is still used in many institutions around the world. Lobotomy, for example, was a surgical procedure in which the frontal lobe of the brain was removed in order to control aggressive or emotionally unstable behavior. However, the procedure often left patients in a listless, emotionless, and personalityless state, and was often performed without the patient's or family's informed consent. Another secret that is often kept within asylums is the administration of psychiatric medications. These drugs can be extremely powerful and, in some cases, cause serious and permanent side effects. In addition, many patients are forced to take these drugs without their consent, which can constitute a violation of their human rights. It is also common for clinicians to use physical restraint techniques, such as handcuffs and straitjackets, to control agitated or violent patients. While it may be necessary in some cases, abuse of these techniques can lead to physical and psychological harm. Finally, another secret of the possibilities is the lack of resources and qualified personnel. Many of these clinics suffer from a lack of adequate funding and equipment, as well as insufficient staff to meet the demand. This can lead to precarious and inhumane care, with little attention to patients and lack of adequate follow-up. Fortunately, the approach to mental health has changed dramatically over the last few decades, and many modern mental institutions are focusing on therapy and medication as more effective and less invasive treatments. There is an emphasis on recovering and reintegrating patients into society rather than simply containing or punishing them. However, stigma and discrimination are still a reality for many people who suffer from mental disorders. They are often seen as dangerous or violent, which leads to inhumane treatment and lack of access to quality mental health care. Thanks for watching. For more interesting content like this, subscribe to the channel and turn on notifications so you don't miss any videos. See you next time.